Hi, so you're with Jean Nguyen. My name is Jean Nguyen, and I'm the founder of Milya. So today we're going to describe about the Josh, which is AI Scribe that for clinical notes. It uses artificial intelligence to create to transcribe the conversations and put into clinical notes. So basically, when you start, you reach the signing menu, and then you can access your account that way. Once you have, you're gonna write down your email and then your password, and then continue. And then when you start, usually you will not have any template. So this is an example of a previous template that we've done. And to start a new one, you simply go to record, and we're gonna make a demo of patients that coming for an emergency exam. So basically, we are at presence of file number 1, and patient is coming today for toothache. She's pointing pain on the tooth number on the upper right, which is tooth number 16. She has swollen on her face, and also she's been taking Tylenol and Advil for a few days, and it doesn't help. And right now, the pain is throbbing. It's coming but spontaneously, and it wakes her up at night. And she cannot chew on the right side. Um, so the pain's been ongoing for about a few weeks now, and it looks like the cold it's helping her. However, the heat make it worse. So we're gonna do and then patient also is diabetic and also taking medications for high blood pressure under control. So patients, we're gonna do clinical notes. So first we start doing percussion tests. So we hit on the tooth number 14, and it's 0 on 10. Number 15, she said it's about 1 on 10. Number 16 is about a 7, 8 on 10. And number 17, it's about a 1 on 10. When we do the probing, we see that number 14, we have 1 or 2 millimeter. Number 15, we have about 1 or 2 millimeter. And then number 16, we have about 2, 3 millimeter. And there's bleeding as well. And on number 17, she have about 1 or 2 millimeter of probing. When we do the test, the cold test, we see that number 14 is positive short length, and number 15 is positive short length. However, number 16, it's negative, and number 17 is positive short length. So looking at the x-ray, today we took a periapical, and we see that there's number 16, there's a presence of a deep cavities that has reached the nerve. We see also apical lesions on tooth number 16. So the diagnosis is we have necrosis pulper of tooth number 16 with abscess apical acute. So basically, we mentioned to the patients that the tooth can be saved, but she needs a root canal. And then after that, she will need to restore the tooth with either a crown or restorations. Alternatively, the other options, the compromise, which would be the extractions of the tooth, and we explained to her all the consequence and also the consent about the risk of the root canal. Mentioned about the price, and after her consent, she decided to go with the root canal. And we're gonna start the root canal in next week. So we start with antibiotics first, and we'll see her back for next appointment next week. So we're gonna stop the conversations, and then we're gonna save it. And it's gonna take a few seconds to analyze the transcript and refine the transcript. So here we go. Here we could put the file number here, which is also file number 1, accept it. And then here we have the full transcript. We can edit, or we go technically to summary. And in the summary, this is actually the previous one. So we go to the new one, and then we go to this one, and then we decide that this is an emergency exam, and we're going to choose the emergency exam, apply the template. Again, we're going to wait for uh, uh, the system to analyze the full transcript and classify everything into our template. So let's wait for a few seconds. It's gonna process and give us the summary. So there we go. We have the answer now. So we can look at the Milya, how it processed the informations. We see that the chief complains toothache on the upper right side with facial swelling. And the region is upper right, there's throbbing, spontaneous, localized relief, and also worseness. So it actually mentions about the cold and hot. I mentioned about the Tylenol and Advil, and also mentioned that she cannot chew on the right side. Patient is diabetic and blood pressure under control. We took a periapical, we can see, which show deep cavities and apical lesions. And going down, we see that we do see the test exactly as according to the conversations and the probing. Even the bleeding is mentioned here, and we see that the tooth is negative response to cold. And we see here that with that, we conclude the diagnosis is necrotic pulp with acute apical abscess, deep cavities reaching the pulp, and periodontal with bleeding and pain and swelling, all that. So we start with antibiotics for the treatment, and then we're going to do the root canal as we recommend, and restorations of the tooth after the root canal, either crown or fillings. Alternatively, we can consider the extractions of the tooth. The patients understand and consent to the root canal. We mentioned about the risk and complications, and she decided to go with the prescriptions first of antibiotic and schedule for next week for the root canal. So once we accept everything, unless we want to modify, we can edit, and then we can change informations before we wanted to save it. And then after that, we can copy, and then we can export it to the medical dental clinic of your choice, and then paste it to your system. So that's pretty much it. So I hope you enjoy the demonstrations of Josh with the emergency exam. Thank you.